Hello, I'm Dr. David Emerson, an internal medicine doctor at the Guam Seventh-day Adventist Clinic. Here's a message for your health now. Let's talk about diabetes type 2. It's on the rise and can result in, among other things, obesity, blindness, kidney failure, amputations, heart attacks, and strokes. I'd like you to meet Tony. Tony was a 66-year-old female with diabetes type 2. She rolled into her office in a wheelchair. At 5'3", she weighed 325 pounds, which was more than her knees could carry. Tragically, she was also blind from her diabetes. She also had hypertension. Her blood pressure was 180/90 when it should have been 130/80. She could only afford one of the two prescribed blood pressure medications. She was taking a statin drug, but this only lowered her cholesterol to 200. This is an average level for Americans. Unfortunately, almost half of the average Americans die of heart attack and stroke, so this was not a comforting value for her. To control her blood sugar, she needed 44 units of insulin a day. Now, a normal pancreas in a healthy individual only produces about 30 units a day. Why did she need 44? Well, she was resistant to the effects of insulin and needed more to overcome this resistance. So what should I tell her? Well, I could tell her that diabetes is genetic and there's nothing you can do about it except keep taking your medications and wait for further complications, such as heart attack, stroke, kidney failure, and amputations. I could tell her that she's doomed to carry the weight the rest of her life. Or I could tell her about God's plan for a healthy body, a plan that can many times eliminate the need for medications, a plan actually instituted in the Garden of Eden. And God said, "Behold, I have given you every herb-bearing seed, which is upon the face of all the earth, and every tree, in which is the fruit of a tree yielding seed. To you it shall be for meat." That's from Genesis 1, verse 29. So what did I tell her? Well, I started to tell her of an experiment designed to cause diabetes in medical students. In 1927, Dr. Sweeney put several medical students on a high oil and animal fat diet for just 2 days. First, he tested them for diabetes to make sure they didn't already have it with a glucose tolerance test. He gave them a 75-gram sugar pill and watched how high their blood sugars went. A normal blood sugar should start below 90, and then after the sugar pill is taken, rise to a level below 150, and then drop back down to below 90. The 6 students all fell in the normal range. They did not have diabetes or even prediabetes. Then Dr. Sweeney fed them for 2 days on olive oil, butter, mayonnaise made with egg yolks, and 20% cream. A glucose tolerance test in 4 of them revealed the blood sugars rising to levels over 150, which was high enough to diagnose them with prediabetes. In 2 of them, at 2 hours, it was over 200, which was high enough to diagnose them with diabetes. Fortunately, when placed back on a healthy diet, the glucose tolerance tests returned back to normal. So he produced diabetes in 2 days with oils and animal fats. Well, what was happening to cause this diabetes? To understand, we need to look at how the pancreas regulates blood sugars. What was happening when the healthy medical students took the sugar pill? When they took the sugar, it entered the blood and caused the normal rise in blood sugar. The pancreas sensed this and said, "I'd better bring the blood sugar back down by releasing insulin into the bloodstream." Insulin went into the insulin receptors in the cells of the muscles, the liver, and the fat, and unlocked the doors so that glucose could enter. The sugar then enters the cells, and then it gets stored for energy or burned. In a normal person, the pancreas prevents the blood sugar from ever going above 120 to 150 after a meal. Now, what happened to the medical students when they took the sugar pill after eating the oils and the dairy and the meat for 2 days? The fat in the foods entered the bloodstream, then it moved to the insulin receptors, the keyholes, and plugged them up. Then when the sugar entered the bloodstream, the pancreas sensed this and released insulin to unlock the doors to the cells. But it couldn't because they were plugged up with the fat. So the sugar tried to enter the cells, but it couldn't because the doors were still locked. so the sugar just accumulated in the bloodstream. This process is called insulin resistance. It leads to diabetes type 2 and high blood sugars. This is what happened to the medical students after they ate the animal and processed fat for only 2 days. But are all fats bad? Didn't God make high-fat foods like olives? Preliminary studies imply that it's oxidized fats that cause insulin resistance. Olives, which are high in fat, are also rich in an antioxidant glutathione. This prevents the fat from oxidizing and causing insulin resistance. However, this antioxidant is removed when making olive oil. What about sugar in the diet? In diabetes, blood sugars are high. Is this because there's too much sugar in the diet? Well, many in Dr. Sweeney's time thought this was the case, and many today think this is the case. So to find out if sugar is a problem, Dr. Sweeney fed the same students a high, simple sugar diet with complex carbohydrates as well for 2 days. He fed them sugar, candy, pastries, white bread, baked potatoes, syrup, bananas, rice, and oatmeal. After eating this for 2 days, a glucose tolerance test showed them all to be in the normal range, as seen on the left. Now, I'm not advocating eating refined sugar and candy and pastries. These are poor in nutrients. However, the sugar that is eaten in fruits is healthy because they are rich in antioxidants and phytochemicals. Also, they have fiber in the fruits, which helps release the sugar more slowly into the bloodstream. So what have we seen so far? We can make someone type 2 diabetic with lots of fats and oils. We can, quote, cure these type 2 diabetics by eliminating the fats and oils. Sugar is not the primary cause of type 2 diabetes. Remember Tony? She had diabetes and hypertension out of control. She was 325 pounds at 5'3". She was in a wheelchair because her knees couldn't support her weight. What did Tony do? She actually did what we asked her to do. She started a vegan, no free oil diet. In 2 months, her blood pressure dropped to 94/56, and we had to stop her blood pressure medication to prevent her from passing out. In 1 year, she was off her insulin injections. In 2 years, her weight had dropped from 325 down to 211, about a pound a week, while still in a wheelchair. Ambulatory patients generally experience 2 pounds a week weight loss. This was without calorie restriction or exercise. Remember, she was in a wheelchair. She had a knee replacement and then started walking. So now you can have a full life enjoying a plant-based diet. Consider using almond milk, soy milk, rice milk in place of the dairy products. Use legumes for your protein instead of meat products. Use foods rich in healthy fats like olives, avocados, and nuts instead of animal fats and free oils. Add to this fruits and grains and vegetables, and you have a truly healthy diet. To learn more, consider one of these insightful books. Thanks for watching. May God bring you hope and health now.